Good day, everyone. I am Clayfi Villasencio Itubig from BSN1C, and today I'm going to perform a bed bath returning demonstration. So, a bed bath means is a wash someone who is in bed. And it is very important because it clean the skin and help the skin be free from infections, and it helps to relax the patients being baked and also to feel better. So to do the procedure, I need to wash my hand first. We need to wash our hands to protect your patients and yourself from infection and cross contamination.
Go.
Now I'm done doing the hand washing. Now we're going to proceed to the patients. Then provide the privacy of the patients. We need to close the door and fix the curtains. And then these are the equipment that we're going to use. We have here the bath blanket, the 4 bath towel, and the 3 wash clothes, and the wash basin with warm water, and then the soap and client's comb, and the lotion for moisturizing, and the working gloves, and the bed pan. So next is I'm going to introduce myself to my patients, then inform to my patients what I'm going to do. So, but before that, I need to check the I need to review the chart for the precaution concerning client's movement and the positioning. So, so, tama ba? Okay, done. So, good day, sir. I am your nurse. I am nurse student here, and I am Clay Villasencio Gitubig. And today I'm going to do the bed wash. And is that okay to you, sir?
It's okay.
Okay. So now let us offer the bedpan or urinal to our patients. So for the bedpan, we are need to waterproof barrier to a bedpan, and a trash bag, and 2 washcloths, and a toilet paper. So now we all know that I'm done doing the hand hygiene. Now I'm going to put the gloves in my hands before starting the procedure. So we don't have available gloves beside this, so I'm going to use this instead the working gloves. So now I'm going to provide privacy before I start my skills. The first thing I do is to give my patient a bath blanket to help her stay warm and provide additional privacy. So I'm going to start by turning the covers back from her feet, exposing. So now I'm going to provide privacy before I start my skills. The first thing I do is give my patients a bath blanket to help her stay warm and provide additional privacy. So I'm going to get this bath blanket, then apply this to our patient. So now I'm going to start by turning the cover backs from her feet, exposing only the lower half of the body. Lower half of the body. Are, are you comfortable, ma'am? Ma'am, can you please pull your feet the body? Okay, like this. Okay, thank you. So now I'm going to use the waterproof barrier and put the pad underneath her hips, and also I need to ask the patients to raise her hips so that I can put this pad to her hips. So, ma'am, can you... Okay, ma'am. Thank you, ma'am. So, now, and of course we need to put the bedpan and the same procedure. So since we are not any kind available of a bedpan, so we're going to use this as a bedpan. So let's just assume that this is a bedpan. So I'm going to turn your hips. Same procedure, mom. Then, okay, very good. Then I'm going to pull the blanket to the. Of course, we need to back her feet like this, and then pull this back to the. Okay, then. All right, and I'm going to pull down and raise the bed to the 90 degrees. Okay, how does it feel, mom? I sir?
It's okay.
Okay. All right. Here's your toilet paper. I sir? Here's your toilet paper. And call me after and I'll come back to check on you in a few minutes, or you can push the call light if you are done. And is that okay, ma'am?
Okay.
Oh. All right, then I'm leaving because I'm going to wash again my hands. Okay, ma'am. Thank you, ma'am.
Start.
Hello, sir. I'm back. So, are you finished up on the bedpan?
Yes.
So, okay. So, when I'm in the washroom, I also get a warm washcloth so that you can clean your perineum, and I will get the toilet paper away from you. Can I get your toilet paper, sir?
Okay.
Thank you. Then I'm going to throw this into the. Okay. Now I'm going to apply the new gloves. Then use the bed control to put the head of the back down to the flat position. And after that, pull the cover back to her feet to expose the lower half of the body and the lower back of your body. So, that is enough. Then I'm going to get the trash bag. So I'm going to use this trash bag. So since there's no other available trash bag in our house, so this is let's just imagine that this is a trash bag. This is the eco bag. So I have my patients put her feet flat on the bed, and I will remove the track to the bedpan into the trash bag. So, ma'am, sir, can you move your feet? Okay. Then also this. Then I'm going to, so as what I have said, I'm going to use this for her bedpan. So I'm going to use this to pull the bedpan to patients. Then something like this. Then put this trash bag to the here. So we are now done. And now we're going to set the bedpan on the waterproof barrier, and I'm going to take the warm water washcloths and have my patients roll her side. So, ma'am, can you move in that side, ma'am? Okay.
Okay.
1, 2, 3. Thank you, ma'am. And then, now I'm going to wipe and repair it from the front to back until the clothes away. Until the clothes away and clean. And I'm going to tuck the pad under the hips of that she doesn't roll back into anything, and throw the clothes to the hamper. Ma'am, can you roll back in this side. Okay, rule. Okay. Thank you, mom. Then we're going to throw this bed pad to the hamper. Okay. And now remove the pad, then throw it into the trash can. Humana ko di ako so
Dito.
and now we're going to, of course we need to back this into the current situation. Okay, so now we're going to lower the side rails and assist the patient near to me. So ma'am, can you move closer to me? Okay. Thank you, mom. So first, loosen the top cover and place the bath blanket over the patient. Then pull in this side. Then pull out the top cover of the and replace it. Going to pull the top cover. And now we're going to throw this soiled blanket to the trash can. And now, move the patient gown. So, keeping the bath blanket in place, noted that if our patient has an intravenous line, we must remove the gown from other hand first, then do something into the next arm. So, now, I'm going to go in the other side. So, this soiled gown, we're going to throw this into the garbage. So, next is fill the basin with 2 half full with a warm water with a 43 to 45 degrees. Then ask the patient if the temperature if it is okay to her. Sir, can you check the temperature of the water if it is okay to you?
Okay. Okay.
Okay, sir. Then, next, remove the pillow, then replace the blanket. Before doing the procedure, we need to put this towel into her chest. So, now I'm going to wipe the patient's face. So, before that, we need to ask our patient if it is okay to her that we're going to use the soap. So, ma'am, are you agree that I'm going to use the soap or only the clean water?
No.
Only the clean water?
Yes.
Okay. So to wipe her face, we need to start with her eyes from the inner and the outer canthus. Then turn the clothes before clothing to the other eye. So now, for canthus, then turn the bath cloth to wipe the other side. Then wipe the eyes using this towel, this clean towel to dry the eye part. So next is we're going to wipe her face from her forehead to cheek. So we're going to use the from forehead to cheek. Then fold again. Then to the next. Then next is in her nose. Wash again. in her nose to chin. Towards the back of the ear of the patient. Then fold it into the other side. So, okay. So, next is we're going to use this dry towel to dry her face. Next is we're going to get this towel again. Since we don't have other towel, we need to use this to the hands procedure to wash your hands. So pull this, and then Mom, I'm going to wash your hand. Then replace the towel on the bed next to the patient's hand. Then place the basin and soap with soap dish and place the farther hands of the basin. Then wet the towel with soap. We will put the soap in the towel in order to make bubbles, and then apply this washcloth elbow to arm of the patient. Okay, Mom, thank you. Then put again in the basin. Then tap to make it dry. Tap it using the dry towel. Then next, we're going to wash her from elbow to her axillary. So from her elbow to axillary. Okay. Okay, thank you. Then okay. Then after that, place her hands to her side. Then back it to cover her hands. Then now we're going to proceed to the next procedure to her other side. I'm going to proceed to this part of the patient. So first, I'm going to put this towel in her chest. Then pull it back like this. So since my patient is a female, I'm going to start with a circular stroke from nipple of the farther breast, paying attention to the skin fold going outward to the axilla. But do not do the same with the other breast. Then lower the blanket to cover perineal area. So we're going to lower the blanket. Then now we're going to apply the soap and rinse dry to the client abdomen using downward stroke starting from her epigastrium and hypogastrium towards the farther side. Bath towel to her chest, and as what I have said earlier, that we're going to start with a circular stroke from nipple. So with the soap. We're going to start with the nipple of the patient. Of the farther breast, paying attention to the skin going outward of the axilla. Then also to the next, to the Bisaway rin yung ate. Axilla. Then, okay. Then, top using this blanket. Use the soap and rinse the drained clients and abdomen using the downwards. And stroke starting from the epigastrium to the hypogastrium towards the patient's side. And follow the same to the near side. Okay, done. Now we're going to return this bath towel to the basin and then top to dry the client's abdomen part and also the chest. Then back the blanket to the old position. Then place the towel under the far leg. And now we're going to proceed to the leg of the patient. So now we're going to replace this towel to proceed the next procedure, the part of her leg. Then put the towel and on side of the leg of the patient. Then get again the towel. Then apply the soap. Then from the ankle to knee, wipe it. Then of course, we're going to return this into the basin and then top the knee of the patients to make it dry. Top it. And done. Now we're going to get again the bath towel and then apply it to from knee to groin of the patient. Then return this bath towel to the basin and then of course we need to tap again the groin of the patients. So tap it to dry, to make it dry. Tap it. Okay. So done. It is totally dry. Now we're going to get the towel and then now we're going to proceed to the other part, but the same procedure. So we're going to put this towel to the trash can since this is very soiled. And now we're going to use another gloves. Pull it. And also a new towel for the back of the patients. So, and then ask your patient if she can, or assist your patient if she can to turn her body in that side. So, mom, can you can you face your side from
Okay.
me? Thank you for that, mom. So now, put this towel into her back side of the patient. Now we're going to get with soap. Okay. Then okay, mom, are you okay, mom?
Oh, yes.
Okay. That's good. Okay. Now to put this, then top using this new towel. Now, then mom, now you can so now we're going to apply the new gown of the patient. So this is the new gown of the patients. Then assist your patients to wear her new gown. Next is apply the new blanket of the patient. So now we're going to reposition the pillows of the patient. Then, mom, wait for a second. And I'm going to pull this towel. Okay, thank you, mom. And now, after the procedure, now next is help to assist your patients to cut her nail and also her toenail. So, or check your patient if it is not clean or it is clean. So we're not going to cut her nail. So, mom, can I check your nail? So it is okay. It is clean. And also her toe, it is already clean. So now we already done.
Imagine nga lang man na change ang linen.
So 1, 2, 3, go. So let's assume that we already done changing the linens. And now we're done all the procedure. We're going to clean all the mess here. Then pull the gloves, of course. Then clean everything. Then back those things to the place where they